Welcome, everyone. On behalf of the Brewer Foundation and New York University, welcome to the 23rd Annual International Public Policy Forum Semifinals. My name is Andrea Sadberry, and I'm the IPPF Executive Director. Founded in 2001, the IPPF is the first and only competition that gives high school students around the world the opportunity to engage in written and oral debates on issues of public policy. This year, 311 teams representing schools in 26 countries and 33 U.S. states submitted qualifying round essays on the topic Resolved: Government Should Provide a Universal Basic Income. Judges review these essays and determine the top 64 teams, who then engaged in a single elimination written debate tournament, volleying papers back and forth over email. This process continued for several rounds, spanning 6 months, until the Elite 8 teams were named. Those teams are with us in New York this weekend as guests of the Brewer Foundation. The quarterfinal debates were heard earlier this morning. At this time, we will begin with the first semifinal debate between Hamilton High School of Arizona and Ivy Bridge Academy of Georgia. At this time, I'd like to ask the debaters to please introduce themselves.
My name is Emma, and I'm a junior in high school.
My name is Marie, and I'm a junior at Hamilton High School.
My name is Jenny, and I'm also a junior at Hamilton High School.
My name is Anya, and I'm a freshman at Lambert High School.
My name is Raquel. I'm a junior at Alliance.
My name is Gene, and I'm also a junior in high school at Columbus High.
Let's give them a round of applause. Well, now to introduce our moderator and judges. Serving as our moderator for this debate is Mr. David Baker. Mr. Baker is the Director of Admissions and Financial Aid at St. Mark's School of Texas. Prior to taking this position, he spent 16 years teaching public speaking at the school and serving as a coach of the St. Mark's debate team. Mr. Baker is a member of the IPPF Advisory Board. Our semifinal judges include Mr. Marshall Donut. He's the former Vice President and Senior Counsel for Marriott International. Prior to this, he served as Vice President and Associate General Counsel for Starwood Hotels and Resorts Worldwide. Prior to joining Starwood, Mr. Donat was the General Counsel for the North American Division of Club Med, Inc., headquartered in New York City. He also served as Associate Counsel for Pan American World Airways. Mr. Donat's a longtime supporter of the IPPF, and we're thrilled to have him here today. Mr. Alex Puy is the Zone Europe Chief Financial Officer for the world's largest brewer, Anheuser-Busch InBev, and is based out of Brussels, Belgium. Mr. Puy has over 13 years of financial experience in control, tax, business planning, treasury, and mergers and acquisitions. Mr. Puy was an award-winning high school debater at the Alexander W. Dreyfus Jr. School of the Arts in Florida. With his help, his school won the IPPF in 2006 and 2007. He now leads the IPPF Circle of Champions, an IPPF alumni organization, and serves on the IPPF Advisory Board. And we also have Mr. Noel Salesi. He's the Director of Development at CareLink International, where he leads a team of professionals who are dedicated to developing solutions for corneal blindness in underserved countries. Mr. Salesi helped found the International Debate Education Association and for many years directed the Open Society Foundation's Network Debate Program. He has helped establish debate programs in over 40 countries around the world and has coached debate at Hunter College High School for 35 years. Mr. Salesi is a member of the IPPF Advisory Board. Ladies and gentlemen, a round of applause for our moderator and judges. Finally, a quick reminder to please silence your cell phones, those in the audience, and I will now turn things over to Mr. David Baker.
Thank you very much, Andrea. We will begin the debate with the opening speech by the affirmative. This is an 8-minute speech. You can start when you're ready.
The best solutions may be the simplest ones. The idea of a universal basic income has been supported from the time of ancient Athens to that of Martin Luther King Jr. as a solution to deep-rooted poverty. However, universal basic income policies have been stuck on the bench for far too long. It's high time we let them play. Current welfare programs are striking out. USA Today in 2023 reports that 40% of people who applied for welfare had trouble proving eligibility or getting benefits when they needed them. And although some can access welfare benefits, we're talking about poverty that erodes prosperity and well-being. Good is not good enough. Thus, we affirm that governments should provide a universal basic income. The burdens of this round are as follows. The side that proves benefit to the greatest number of impoverished people wins the round. Programs meant to help those in need cannot risk exclusion. Our first argument is the standard of living. Due to the pandemic, rising inflation, and the war in Ukraine, an additional 90 million people globally lived in poverty in 2022 compared to pre-pandemic projections. Social protection measures have been introduced by 211 countries. However, 92% of these measures were short-term. A UBI would allow the previously impoverished to cover basic necessities, such as groceries and rent. A UBI experiment in Stockton, California that provided $500 a month helped recipients pay for essentials, with 40% of purchases going to food and 24% to goods and clothing. Globally, the same results hold true in Namibia, where the basic income grant reduced the number of recipients living below the poverty line by 51% and increased school attendance by 90%. Past daily necessities, however, a UBI covers health needs. A UBI offers funds for impoverished families to cover health needs by affording quality medicine and regular doctor visits. Let's look at the numbers. The University of Toronto reports that Mincome, a Canadian guaranteed income experiment, documented an 8.5% reduction in hospitalization rates, particularly for accidents, injuries, and mental health. Indeed, a UBI experiment in Finland notably resulted in lower levels of stress and depressive symptoms, as well as increased financial well-being. The perceived safety net of a UBI would not only improve mental health, but also actually improve financial decision-making. Our second argument is the economy. UBI stimulates the economy in three key ways. The first is through investment. Providing every individual a guaranteed income increases consumer spending. Consumer spending coincides with overall consumer confidence in a nation's economy. Fundamentally, people are more likely to invest in an active economy, and when businesses see this increased consumer spending, they will draw in more investment and thus experience more growth. The IMF corroborates that strong consumer spending supported growth in Asia's three largest economies in 2023. Secondly, consumer spending will expand the supply sector. According to the laws of economics, when aggregate demand increases, supply naturally increases to compensate as well. Supply sectors will have to develop and match the demand over time, expanding economic growth. The third is through increased workforce productivity. By improving the financial, physical, and mental health of recipients, a UBI has been found to increase the quality of work employees perform and provide the financial security needed to find high-quality jobs. For example, in the aforementioned Stockton UBI experiment, those receiving the cash transitioned from part-time to full-time employment at twice the rate compared to those not receiving the UBI because they had breathing room and the space to financially take chances through the pursuit of certain career-boosting activities. Moreover, AI and automation are currently growing at a rate that threatens the job security of hundreds of millions. 400 to 800 million jobs around the world could be lost to AI by 2030. As the world changes, UBI is a way to ease the transition, not necessarily a substitute for work, but a supplement to work. The faster that jobs are replaced, the greater the need for societal insurance that protects against technological change and broad economic crises. By giving people guaranteed income, UBI could provide the crucial support for the temporarily unemployed to stay afloat during rapidly changing times. Our last argument is welfare programs. Targeted welfare programs are often insufficient and inaccessible. In the United States, research shows that even popular public assistance programs such as SNAP are restricted in addressing income inequality and related disparities because they often leave gaps and do not provide consistent food security. Welfare programs ignores individual income volatility factors, whereby people's qualifying income fluctuates with changes to their income. 100 million Americans who do not qualify as impoverished still experience many of the same hardships as those officially in poverty, with 32% of Americans falling in and out of poverty at any given time. For these Americans facing fluctuating incomes, obtaining assistance from welfare programs has proved nearly impossible. Luckily, having a UBI means there is a blanket solution that removes the problem of inaccessibility. This prevents exclusion errors, the types of challenges that are most common with other welfare assistance programs. This is especially the case with developing countries, which face obstacles with corruption and limited welfare programs and accountability. Just like a leaky roof, It is much more effective to replace the entire roof instead of changing each individual tile each time a new leak is discovered. Furthermore, there are two problems with the inherent structure of welfare. First, social welfare does nothing to prevent people from falling into poverty. Welfare constitutes a reactive system that only offers assistance once families fall into poverty, meaning welfare does little to prevent families from falling into the poverty in the first place or to foster financial independence, which a UBI solves by offering benefits regardless of whether a family has sunk into poverty. Secondly, welfare keeps those in poverty from climbing out. Currently, welfare systems such as food stamps and unemployment benefits still present a cliff edge in which the benefit received from the program decreases as people take on an element of work. This system causes higher tax rates on work and generous benefits for the unemployed, which leaves the economy with fewer people seeking work and therefore less production. However, under UBI, taking a job or receiving an income raise does not mean that benefits are forfeited or diminished. Thus, UBI does not diminish working incentives as federal programs do, but rather contributes to increased labor market productivity. To increase living standards, invigorate the economy, and fix society's roof, Hamilton proudly affirms.
The negative constructive for a period of 8 minutes, please. You may begin.
Improvements in status quo approaches to welfare does not alone justify affirming UBI as a solution to existing problems. Our case against the resolution argues that UBI is not a desirable solution, ineffective at resolving these problems and doing more harm than good for societies. To win this debate, affirmative must prove that the best method is a universal approach and that the best tool is income in the form of cash payments, i.e. that UBI is a better policy option than opportunity cost alternatives for resolving identified harms without creating more significant problems. As a report on UBI by the Foundation for European Progressive Studies makes clear, the debate hinges on whether UBI or expanded social policies should be prioritized. There's just a choice to be made between basic income or alternative policy reforms. Our negation of the resolution will both specifically indict the affirmative's justifications for UBI and also advocate for superior alternatives to addressing status quo deficiencies, either of which warrant a negative ballot. First is contention 1, the bad idea of UBI. It is important to note that affirmative misleading claims empirical success for UBI. Keep in mind that a lot of the pilot programs that we've had before haven't actually worked. They weren't universal, which means that you can't apply them anywhere else. But moving on, it's unclear whether significant changes to the status quo are even needed to address poverty. Global trends dispute their criticism of targeted welfare failing to address poverty. World's Vision Global Poverty Fact Sheet from spring 2023 documents poverty has steadily declined, decreasing from 36% of the world's population to 9.2% in the last 30 years, with the temporary spike during the COVID pandemic being an outlier that is receding as the global economy recovers. But even if change is needed, UBI is not the correct choice. We identified 2 economic reasons. First is debilitating taxation. Existing funding schemes for non-universal pilot programs are not comparable to what nationwide UBI would entail. Multiple scholars who have analyzed UBI proposals conclude that it would require doubling tax revenue in economically developed countries. Economics PhD Hoynes and Rothstein warns that this would direct much larger shares of transfer to non-disabled households than existing programs and much more to middle income rather than poor households. While Center on Budget and Policy Priorities Greenstein goes even further, warning that it would increase poverty and inequality. Attempting to resolve this regressive dilemma would not work, because proponents of UBI claim that it has been means-tested welfare, as UBI's funding mechanism requires the exact same complexity. Second is spiraling inflation. UBI focuses exclusively on how much money consumers have to spend, ignoring the inevitable reactions from sellers as to the prices they charge. Even if UBI has some long-term effects on productivity, the more immediate consequence is inflation. Macroeconomist Winningham explains that when demand causes the price level to rise because of low supply, the value of UBI erodes, requiring an increase in the size of the UBI, which will then only increase the price level again. Additionally, more than just printing money, the AC fails to account for UBI transferring money to those whose basic needs are already met. Upper income individuals already spend proportionally less of their money on necessary expenses and are less deterred by higher prices. In contrast, higher prices curb the spending of those who have very little, as they can no longer afford to pay. Thus, UBI inflation exacerbates inequality as the economy has more disposable income but less consumption on the bottom half of their distributions. The impact of such spiraling inflation are not only a short-circuiting of UBI's purported benefits for low-income populations, but also dangerous political repercussions. Economics PhD candidate Boone's research for the IMF analyzed 133 countries and concludes that high inflation drastically increases the risk of interstate conflict as citizens blame poor economic conditions and unemployment on other nations. These conflicts then lock in economic crises, destroying infrastructure and institutions, and trapping nations in a vicious cycle of instability. Next is contention 2, a superior alternative. Giving cash to all individuals is not the only universal approach to meeting basic needs. Universal Basic Services, or UBS, addresses basic needs by providing goods and services such as education, healthcare, food, shelter, transportation, and information. Many countries already have experience with universal education and healthcare. UBS recognizes the basic human rights to life and dignity and fulfills the government's obligation to ensure everyone's basic needs are met. But UBS is superior to UBI in multiple ways. One net benefit is real access. Giving rural residents money for healthcare, transportation, and education is useless if they don't have the hospitals, good roads, or schools nearby to access those things in the first place. Another net benefit is social cohesion. Hasseltine Institute for Public Policy postdoctoral fellow Thompson argues that whereas UBI atomizes and privatizes, UBS is pro-social in that it strengthens the ties of reciprocity, solidarity, and sociability that help bind society into a functional and cohesive whole. It's also a net positive on inequality. Gog finds that the proportion of income spent on basic needs is drastically different between the haves and have-nots. For those living in the poorest quintile, 76% of their income would be required to pay for basic services compared to only 14% for those in the wealthiest quintile. Thus, UBS, by directly addressing basic needs without giving people money to spend on luxury goods or new cars, UBS is more economically efficient. Finally, UBS is superior to UBI in terms of environmental sustainability. New Economics Foundation Principal Fellow Coote explains how UBS can play a crucial role in tackling the climate emergency because it promotes universal sufficiency, pooling resources, sharing risks, and working together. That's a throwback to the pro-social argument we made earlier. When you work more together, you're able to solve more effectively with any government policy. It also helps build broad support for limiting consumption and constraining excess, and collective services have a smaller ecological footprint than privately funded alternatives. With engineering PhD Pierce's research finding that every 0.1 degree Celsius increase in warming can be expected to cause 100 million deaths, the implications for properly aligning the economy with ecology is paramount. Now, we're going to address other specific claims about the only unaddressed listed net positives of UBI. The first is healthcare access. PC finds that UBI does not cure addiction, poor health, lack of skills, or other factors that contribute to and exacerbate poverty. In fact, in many UBI studies of mental health, unfortunately, none of the identified studies directly compare the effects of payments which were truly universal. That is because, as we told you earlier, there have been no real examples of universal basic income, but rather modified means-tested programs. And if the affirmative is right in saying that simply modifying the status quo instead of spontaneously implementing UBI improves healthcare, that's a place to vote negative. Even if they are right and UBI increases money to afford better quality healthcare or other services, Kerry affirms that UBI has no effect on the actual ability of individuals to see healthcare providers or other services. Thus, even if they win this argument, you're voting negative. Throwing $1,000 at people doesn't build roads or hospitals that people need to use healthcare in the first place, but UBS does. That's a place to vote negative on the global scope of the resolution. Yes, countries like the US might have the transportation infrastructure necessary for most people to access healthcare, but even here we have problems with rural areas. Think about Kenya, Africa, Namibia. Do they have the money to build the infrastructure to use that money in the first place? The answer is no, and that's why you're going to be voting for the negative team at the end of today's debate.
Thank you. Now start with the, we have 90 seconds for the affirmative to prepare for the second speech.
Is there any specifically you need help with?
1 minute. That's time.
Then if everyone's ready.
Well, we're gonna figure out how to turn this off first. Okay. 5 minutes.
Let's start on the burdens. We agree that we have to prove that UBI is the best solution. But what they miss is that they don't address the fact that they must prove that whichever situation is the best that brings the most benefit to the people in poverty. Let's go on to our case where they talk about how UBI, the studies that we talk about aren't actually correct. But that's not true. We should prefer the case that has studies and has evidence over no studies at all. The only thing they say is that it doesn't replicate the exact UBI, but these programs were made in mind to replicate actual UBI programs. That's why they should still be evaluated. But then they say that we have no effect on their actual ability to access any of these benefits, and they apply their UBS case. We'll get to that on their case, but we still say that with an increase in purchasing power in the lowest majority, that actually has an effect on the ability. So let's go on to their case first. Let's talk about Alaska, for example. Our Alaskan study shows that UBI is effective and it meets requirements. It's government funded and it's been going on for more than 42 years, showing no sign of stopping. But what's really crucial here is that a lot of people support the Alaskan UBI. They say that they would actually have income taxation over getting rid of the UBI. Then they say that COVID-19 and the increase in poverty after that isn't an actual representation because it was a temporary spike. However, it's really important to note that this just shows how ineffective welfare programs actually are. That's because welfare programs are designed specifically to measure how they react in catastrophic situations such as COVID-19. We saw poverty increasing. We see people being left out of welfare programs. That means it's time for a solution. It means it's time for UBI. But then let's talk about feasibility in general. They say that it can't be funded, but we'll tell you why. First is through progressive taxation. On a contemporary example is the wealth tax, such as the ultra-millionaire tax, which, according to UC Berkeley, would generate at least $300 billion in government revenue per year without raising taxes on 99.95% of American households that have net worths below $50 million. But even if we were to cut spending in welfare, UBI is still better. Remember our case where we tell you that over 40% of people in poverty and over 100 million of people that suffer the same conditions of people in poverty don't actually get access to welfare benefits. UBI is the solution here because it guarantees access and we're helping all of the people in poverty who need it. But then we would say that the economy actually solves for all of these problems. Remember the warranting that we give you. First is that it increases investment. And through that increases consumer spending, and therefore we're expanding the supply sectors to bolster the economy. We have more industries, and that's a net benefit. But then let's go on to their inflation responses. First, they say that the inflation would happen because they concede that there would be long-term benefits to UBI. It's just that inflation happens first. So as long as we prove that inflation doesn't happen, we're winning this round. And that's because a UBI would actually lead to an increased demand, but it would actually lead to increased supply as well. And that's because of more workforce productivity. Insofar as people actually have breathing room to get more training, that means they can actually go into these industries and supply will increase with demand, inflation doesn't happen, and the economy is even stronger. But then we would also say that they're saying we're just transferring money and that there's more like purchasing power, but we would say that purchasing power only happens for the people in the lowest bracket. That's because people in higher brackets already have the money to afford the goods that they need. Only people in the lowest bracket are the ones being affected by these UBI policies, and that's why we have a net benefit, because we can actually give these people the benefits that they need. But lastly, let's go on to their alternative of UBS, and I'll prove to you why UBS isn't a good solution. UBS is not universal, and that's because they concede themselves that the rural situations are much different from the urban situations. That means that the situations are actually different, and that the investment that is needed in each of these areas is actually different. That's not a UBS. But then, let's look at bureaucratic problems. They're advocating for higher education, higher hospitals, and more roads. This is going to take a lot of time, a lot of planning, a lot of resources that we don't have. Insofar as this will take years, even decades to manifest, and these people are still in poverty, let's look at the better solution, which is UBI. That happens instantly. You instantly get that transfer of money, and you can use it to your benefit. But lastly, let's talk about why UBS isn't a good solution. Because the American population, the needs differ with each of these groups. In rural areas or in lower poverty areas, the needs or the investment that they're going to give into daily necessities is much different from the higher populations. If we give them a universal basic income, they get freedom.
.90 seconds before the second affirmative speech.
Okay, for this time frame stuff, right? Short term we argue inflation because they say that UBI would be short term, and then long term we say UBS solves for everything else.
All right, I need a 4-year-old to come help me turn this off. Somebody who understands. I've done it twice now, and I don't know how to make it. What did I do? No, it's still going.
How can that be?
I don't know. That's why I was asking.
Okay, let's turn the sound down, and if you just want to time it visually.
Do that.
Is that a
Do you know
different
how to
program?
fix it? No, I'm fine. I did something that
If
set
we
this
turn
thing
the
up. Did
sound
you
down
turn
and-
the sound down? Is that
Yeah,
how you
so
got it
it-
to stop?
Right. Well, for the time being.
Okay. Well, for whatever reason, it stopped.
Okay.
All right, you've got like a minute. think that's about time. Second negative speech for a period of 5 minutes. You can begin when you're ready.
We'll agree with their framework that we should prioritize people that are the most impoverished, and whoever affects the more people should win this debate. On our first argument about UBI being a bad idea, they focus on the idea that studies of UBI show that a UBI is effective. But let's look at their examples. For example, in the one in Finland, not only was Finland's UBI discontinued after 2 years due to financial strain, but the reason why Alaska's fund worked is because Alaska has access to natural resources such as oil that allow them to fund UBI that other developing countries simply don't have access to. Not to mention in Finland's UBI, the basic income was only provided to 2,000 unemployed individuals. That is not universal, that is not unconditional, and that is not a universal basic income that can be applied to every single country. On our first argument, specifically in our argument about taxes, they provide to an example of the wealth tax and suggest that a wealth tax would work. This might work in countries such as the United States, who already have higher income individuals to tax. But in developing countries, there are barely any richer individuals for the wealth tax to be implemented. So if a tax revenue gets doubled, universal basic income simply cannot be funded. Simply put, an effective UBI is unaffordable, and an ineffective UBI is the only one that could be affordable. For example, they tell you the idea that a UBI could also increase supply, which might counteract the issue of inflation. But here's the specific issue. Number one, our argument about UBS solves the problem better. In a world of universal basic income, they don't look at the perspective of businesses. When businesses recognize that consumers have more money in their pockets, they have more incentive to increase prices because they believe that other people have income so they can afford those prices. That is according to Archetto of the Hill. That means that under a UBI world, inflation would be a lot worse, but under UBS, those price issues don't matter because now it's the government setting prices for things such as healthcare facilities, such as transportation. On our second argument, specifically about the benefits of UBS, they tell you many different examples of how the welfare state has failed and it's reduced and increased poverty. Our argument simply is that perfection should not be the enemy of progress. Generally speaking, since global poverty has declined from 36% to 9%, and the COVID pandemic was definitely an anomaly, there were issues such as the pandemic preventing people from going to work in the first place, means that other alternatives are significantly better. For example, in our argument about UBS, my opponents say that UBI is the beacon of solvency and is a whole lot better because it increases purchasing power. But here's how a UBS would work. If ordinary Americans are able to not worry about things such as medical debt or transportation because now it's funded by the government, now people with UBS have more purchasing power. They have more money in their hands that they can use for the economy. It works the same way. The difference is you eliminate the middleman. They tell you the argument in their rebuttal that wins us this debate. They say that people's differences and issues differ by impoverished person to impoverished person. That is exactly our argument. Throwing $10,000 to every single person in poverty isn't going to solve for the difference in needs that every single person needs. But under a universal basic services system, people can choose what their issues are. If they can't pay for medical debt, then they have access to healthcare facilities. Our solvency works a whole lot better. With that in mind, let's address their first argument about standard of living. Number one, much of the burdens they talk about can already be resolved through a UBS. You're providing healthcare, you're providing public education, and you're providing transportation. All of these are key necessities that a UBS pays off and opens up purchasing power of the everyday individual to invest in everything that they discuss. And also, remember what Anya tells you in her first speech. A lot of the examples they talk about UBI helping health aren't all what they seem. Not only were these payments not universal, but they were only provided for a couple months. A couple-month program will never tell you how a UBI that goes on for eons in the infinite future will actually affect people that have healthcare issues. On their second argument about the economy, they specifically talk about the argument about automation, but we would say that UBI leads to gradually declining wages. Not only would workers be less likely to put pressure on companies to provide wage benefits since they have UBI with them, but corporations would be able to justify cutting their wages to minimize their supply costs, as they talk about, by pointing to the existence of a UBI. That's why Cambridge University socialist Zamora explains that the UBI will function like a war machine for lowering wages and spreading precarious work. Similarly, they talk about the argument about increased supply. But number one, this is not necessarily economically true. The only way supply naturally increases is if companies have the resources necessary to increase supply. It would be bad to assume that a general increase in demand would always lead to a general increase in supply, because that's not how economics works. Lastly, the argument about welfare programs should not be the most important part of your debate today, because our alternative is not welfare programs or targeted aid like they discuss. The alternative that we are presenting as the negative is universal basic service systems. And as long as we can prove that this is the best form of social reform for people in poverty, you're always casting a ballot for the negative.
That's time. Okay. We will now start, we'll have about a 12-minute cross-examination period. I'm going to ask because they're sitting at the end of the road. Jean and Jenny, will y'all keep up with who's asking and who's answering within your team? Everybody must ask a question. Everybody must answer a question. Very important caveat about this. If you decide to jump in on the back end of one of your team members' answers, that counts as one of your answers, okay? So you can't answer every question by just hopping onto the back of somebody else's answer. Do you understand? Okay. With that, we'll ask for, go in this order. Affirmative, a question for the negative.
Can I get a time frame on the development of UBS? How long is it going to take for all of this infrastructure to be put in place in both developed and developing countries?
So it would be flawed to assume that a UBS has never been implemented. The foundations for it exist. For example, many countries have access to things like universal healthcare. Countries such as the US have access to things like public transportation. So the foundations of a UBS exist, but the foundations for a UBI doesn't exist. So not only is the time issue not that terrible, but worst case, we would say spending time on a project to help most people in poverty is comparatively better than taking a hasty approach and assuming that providing money for everyone is the best effective solution for people in poverty.
Can I respond to that?
Another question, a question from the negative for the affirmative.
Okay, so I have a question about the affirmative advocacy for the solvency specifically. So let's take example, rural populations that don't live near hospitals or accessible transportation, or urban populations that live in food deserts that don't have access to food. What evidence do you read that simple cash payments resolve the issues of access?
We would argue that even because you tell us that needs differ, by using cash payments, people can be flexible with what they need. Not everyone in rural areas even need this healthcare infrastructure. And even so, I understand you're going to bring up the point about UBS, but UBS would be a lot longer to have this kind of infrastructure and development. If we're going to be flexible with the needs of vulnerable populations, UBI is the answer.
Affirmative for the negative.
Insofar as current welfare programs have gaps where like people try to give the aid to them and then they have gaps in like who receives what, isn't the same thing going to apply to your UBS system where you said yourself that needs are going to differ, so you're going to provide aid to people differently based on what they need? How are you going to ensure that this is going to be done in a fair way and people are not going to be excluded or left out?
The most important word in universal basic services is universal. We are providing every single service that a person would need. The reason why that is important is because the reason why people fall through the cracks in targeted welfare schemes is because there's a means test requirement, where if you're under a certain line, you don't get it. The difference is universal basic services provides services to everyone and the infrastructure to access those services. That's critical. That means everyone has the ability to access the services they want to, which means no one falls through the cracks even if they use different services than others.
Can we get a follow-up on that? Can we get a follow-up?
It counts as a question, but you certainly may.
Okay, if your argument is that UBS provides every service possible, wouldn't that be more expensive than a UBI?
I can answer this. So just to clarify, a UBS only covers the necessities of food, transportation, healthcare, etc. But to address the issue of cost, a UBS is significantly cheaper than a UBI for a couple of reasons. For one, once the infrastructure necessary is in place, then we don't need to continually spend on it, in comparison to a UBI where people are required to have annual payments. And secondly, it is also cheaper because of the fact that, as Rakil said in his speech, a lot of the things necessary for a UBS, for example, public transportation, public education, are already in place, meaning there's on net less funding required. That is why our evidence indicates, when we look at Canada, for example, comparing how much a UBI would cost to how much a UBS would cost, it is approximately half the total revenue the government must generate to fund such a program.
So for UBS, you don't need sustained funding. Your argument is that you fund it once and leave it?
I mean, not necessarily. Well, our argument is that once we have, for example, if I build a bus stop in an area, I don't need to continually fund money year after year, month after month to fund that
So
transportation.
your argument is about hospitals.
Negative question to the affirmative.
I can ask a question. Yeah. Affirmative. In your second speech, you say that purchasing power would only be used for the people with the lowest income. That makes no sense. Definitionally, a UBI is given to everyone because it is universal, and the fact that we're giving rich people like Bill Gates the money to buy another car is exactly why inflation spikes. The question is simple. If the universality of UBI means it's given to everyone, and the income means that it's up to personal choice how that income is used, then how can you guarantee that A, the money spent only in what the poor actually need, and B, that inflation won't increase when you give upper class people the money to overstimulate the economy with?
So when you talk about Bill Gates buying another car, I'm pretty sure Bill Gates has enough money as he wants to buy as many cars as he wants. This UBI isn't going to make or break his next car, but it will make or break the next necessities for these people in low income, like who need to buy basic necessities. And that's why we say the purchasing power only increases for those people who are struggling to buy the necessities they need. People like Bill Gates already have the money to get what they want.
Affirmative to the negative.
So you talk a lot about using foundational things for UBS, but can you give me an example of a lot of countries that have developing countries that have a lot of foundational, healthcare services, education services that we can just piggyback off of for UBS?
Okay. I think we can give you a lot of examples of countries that have these infrastructure in place. All of the developed countries have already set up a model for what we want to see in the world. Canada has Medicare for all. The US has public education. Developing countries model off of developed countries, which is why if you look to Africa or Southeast Asia, all these countries are developing similar services like public education and public healthcare. The very, very important thing is that when you have universal basic services, you're just able to build off the plans that already exist. We don't even need to win that it's in developing countries if we can win that the model already exists in developed economies.
That's time. Affirmative for the negative. Negative for the affirmative.
So you cite that to implement a UBI, one of the methods you'll do so is through progressive tax models, but with more advanced countries such as the US and Germany that could implement such measures, studies from the IMF suggest that developing countries do not have efficient tax administrations and lack reliable statistics. How would developing countries go about implementing such a system to specifically redistribute towards lower income individuals?
Right, so this can be built off of our economy argument, right? We are saying that implementing UBI is going to help the economy of the country overall. So for developing countries, this can help the developing countries build to be better over time so that they have more of a formal sector to tax their people. So for example, this could mean that we start off with a lower amount of UBI to get their economy started. And once that economic growth and economic activity happens, we're going to see people spending more, consumer spending increases, and the whole overall supply and the economy grows. And that means the government's going to be more developed overall, and then they can increase the magnitude of UBI to be more when they have more people and more economic activity to tax.
Negative for the affirmative.
Okay, so back to your UBI.
That's fine. Go ahead.
Oh.
Go ahead.
Go ahead.
Go ahead.
Okay, back to your UBS thing. You say that we can accommodate for different needs by giving needs to everyone, right? But doesn't that mean that you still have to figure out what the specific needs are? For example, a rural person buying a house is going to be different from people buying a house in urban areas. Doesn't that mean there are still a lot of bureaucratic hurdles that you have to overcome in order to effectively implement a UBS?
There wouldn't be no bureaucratic issues because governments have already determined what the needs of their people are. For example, if you look to areas like sub-Saharan Africa, they technically have healthcare systems because they understand healthcare should be a fundamental human right. They have access to things like housing subsidies, not as accessible, but it exists. The fact is these governments have already tried to fund things such as providing basic needs, but they've all been very dichotomized and very fractionalized. It's not very cohesive and foundational. For example, if you look to countries like sub-Saharan Africa, or the area of sub-Saharan Africa, they implement initiatives to try and reduce their slum populations of over 1 billion people. But those initiatives are super fractionalized and they don't put much funding in general. A UBS would mean there's no bureaucratic hurdle. You're just making those initiatives more general and more focused so the government actually addresses those issues. That's an example.
Can we respond to that?
You can ask a question.
Okay.
You can't make an.
Okay. So if a government already knows what its citizens need, why are welfare programs leaving out people right now?
Once again, one, our advocacy isn't welfare programs. We've made that very clear. Our alternative isn't a welfare state, it's a universal basic service system state. And secondly, looking at the pinpointed specifics of a welfare state doesn't tell us the general trend of global poverty. Once again, global poverty has went from 36% to 9%. So sure, welfare states will never be perfect. No system to get people out of poverty will ever be perfect, and we shouldn't pursue that perfection because it'll never happen. Our argument is simply that implementing systems that are very effective, as like ones we have right now, including UBS like we discussed, would be the best step forward.
But you haven't
Now, a
answered.
question from the negative for the affirmative.
Okay, I did have a quick question about the response you gave previously. You said that a universal basic income now is going to be a tapered UBI, where now people are providing incomes at different, the government provides income, like less amounts of income in the beginning, and that income will slowly go up as the economy progresses. What example of a tapered UBI do you explain?
Yeah, so our argument for that specifically isn't that they're in the beginning going to have less, but it's as they gradually grow the infrastructure, they're able to be more effective with their programs, which means because of that economic stimulus. And we would argue that with specific UBI programs, there's no need for this with the specific ones we talk about. For example, Alaska's government funded for 42 years, they've been able to sustain that same level. But in this case, where you're making the argument that in the beginning they would have to like taper out or have financial struggles, that's one route they can take because it's extremely effective for these developing countries to now implement that policy.
Okay, question from the affirmative for the negative.
Okay, I just wanted to like clarify what because I don't think you fully answered my partner's question when she asked like insofar as welfare programs are implemented similarly to your UBS and that they identify like they give specialized help to the people who need them, like based on what they need. So it differs from person to person. And the current system of welfare leaves people out. How are you ensuring that like the UBS is going to like give like everyone and ensure access to everyone equally?
On your way, thing.
The specialization of means-tested schemes in the sense that they're like, I'm only going to give this much to people under this line is precisely why it's failing. I already reiterated that universal basic services is universal. We're taking the basic necessities and we're providing it for every single person. The really important thing to keep in mind is what Akil told you. He told you that in South Africa and all these other places, they already know where to target. The question is, what cohesive framework can allow us to effectively solve for those populations? Our advocacy is that UBS is that framework, and that's how the negative would win the round.
Final question by the negative for the affirmative.
So generally, you tell us that a UBI would be an effective tool and that because it hands up cash instead of other forms of compensation to everybody. But what reasons would businesses have to not raise prices as capitalist economies would incentivize them to do?
Right.
Anybody?
Businesses recognize that purchasing power is only increasing for the people at the bottom. Insofar as our evidence finds that, for example, in Alaska, 72% of people actually started saving their money because they could afford to save it instead of having to spend it. They realize that if they want any growth in their business, they have to keep prices low so that they can still get products.
Thank you very much. That concludes the cross-examination between the two teams. We'll now start with the cross-examination by the judges. Judges, appreciate if we would sort of try to at least, and I understand the conversation needs to flow, but if we could sort of pay attention to how many questions are being directed to each side so I don't have to hop in. So anybody, either side, fire away.
Okay, so this is Marshall. A question for the negative. I'm sensing that this debate is coming down to, among other things, the comparison between UBI and UBS, right? And I'm hearing that UBI is targeting low-income people. Is that right, just for affirmative? Or is it everyone gets the same amount of money, wealthy and poor?
Everyone gets the same amount of money, but it's going to help lower-income people more.
Okay, so is there waste if you're giving Bill Gates money that should be better served with poorer people that need it? So it's really an affirmative question.
Yeah, so we would just argue that the UBI is a much more effective system than anything our opponents are arguing, just because even if we're giving money to everyone, the benefits are occurring most in the lower bracket. But on the other hand, when we're talking about UBS, there's a lot of planning needed. We don't have a specific time frame, and it isn't even applicable on a global scale where they don't have the foundations that they're talking about. So in this case, it's more effective because we're giving people the purchasing power and the freedom that they want.
And oh, sorry. to specifically answer your question about whether it's a waste for middle and high income, we would say it's not a waste because those people with more purchasing power, they're going to save that money and put it into investments, which overall helps the economy overall, and that's going to help everyone.
You're sure they'll put money into investments?
That's what we found with the study of Alaska. That's what 72% of respondents did.
Yeah. So may I just flip the same question on its head? Universal basic services would benefit, aside from the timing issue of how long it takes to put into place, benefits who? Does it benefit everybody, the wealthy and the poor? Do you get enough to the poor and the most needy?
In a similar vein, just like how they argue that richer people wouldn't use their $12,000 under a UBI, under a world of UBS where you're providing access to things like transportation, providing healthcare, lower and middle income individuals would greatly benefit from those accesses. For example, if someone's under medical debt, a UBS alleviates that medical debt because now there's access to healthcare. And kind of flawed logic that the affirmative suggests is providing money will resolve those issues. But as an example, if you're in a rural area and you face health complications, if there's no hospital near where your rural area is, having $10,000 in your back pocket won't all of a sudden create a hospital or provide you healthcare access or give you the transportation necessary to access one. Our argument is that we should prioritize actual access, providing actual things like healthcare and transportation, rather than providing money and hoping that somehow, some way, people in rural areas will get that access.
That's good.
I have a question for the negative. And maybe just for disclosure for the full panel here. Inflation is very important to me as a judge. So you've said that your UBS program would require, more targeted and maybe one-off type of investments. But it's still new money being spent into a respective geography. Let's say an MRI machine costs, $10, $15 million, right, or something like that, and you need MRIs to be able to do modern healthcare. So help me understand the inflationary impacts of what I'm guesstimating to be trillions of dollars of spend from maybe a government rather than necessarily given to individuals, but still new spend being given in an economy to be able to build your universal basic services.
I think the distinction is between where you're giving that money to. When you give money to consumers, private corporations are much more likely to increase their prices and increase inflation than if you put it into the government, where it's not a product that we're selling out to people. It's not like we're constantly going to be pushing in new stuff which is going to push up inflation. No, it's a service that everyone can use. Comparatively, the UBI they talk about encourages corporations who have a track record of increasing prices when they see people have money to increase prices further. That's why we say that uniquely, it's a lot worse to provide money to private corporations than it is to provide money to governments who provide services compared to products.
But just as a follow-up.
Sure.
I'm the producer of the MRI machine, all right? Let's say I work for GE or something
Sure.
like that. I now know that a government is implementing a UBS system. Well, my MRI machine that was $15 million is now going to cost you $45. Oh, and I also need to build, a new production facility to meet up with your demand. So I'm not sure I 100% understand your point that that no spend from a government agency is free of any inflationary impacts.
So that similar issue has existed, with universal healthcare in European countries, and how that phases out is that there's also competition within the government and the company or corporations that's providing a product. Let's say there's just two companies. One provides it for $45 million. The government won't take that MRI scanner that costs $45 million if another company is offering it for $30 million. If you're making healthcare such that the only way companies can make money through healthcare is through the government funding it, the government will always prefer a system that is cheaper and provides that product for cheaper, which is why, for example, like in areas of European countries where there's value-based pricing of drugs, what that ends up happening is there's competition between pharmaceutical companies, which forces them to reduce prices as the only way to actually get a market for people to access things such as drugs. We think if you generalize that towards general universal basic services, the inflation issue of companies increasing prices under a UBS is far less worse than a world with UBI.
No?
I want to dig a little deeper into this this issue of UBI versus UBS, because I agree, I think this is what this is coming down to. Now you say, oh, it's just the basics: food, health, education, transportation, and housing. Now most of my, and I'm not a low-income person, I guess by definition, most of my money goes to food, health, education, transportation, and housing. Suddenly I'm not gonna have to pay for any of that? It's gonna be given to me by the government for free. Even though I have the ability to pay for it. Supermarket, you go in, take what you need, you leave. Health, just go to the doctor, no bill. Oh, sorry. Education, no tuition. Transportation, I paid $2.90 to go across town on the bus this morning, free. Housing, free. How are we gonna pay for that? You're questioning their ability to use progressive taxation. You've now provided all of these basic services universally. So Bill Gates doesn't pay a hospital bill. Bill Gates doesn't have to pay his check at the restaurant. I don't know. How do you provide all of this stuff for free? You talk about the person in the rural area and said, well, the $10,000 won't get him a hospital, but you're gonna build him the hospital. That's gonna cost a lot more money than giving him, and maybe he could buy a bus ticket to where the hospital is, right? How do you pay for this thing? This UBS seems pretty steep to me.
So I can answer this question. So the way we fund such a UBS is twofold. Firstly, we can use the existing tax systems that, for example, we use in America to fund things like welfare or to fund things like transportation, things that the government provides generally in the status quo. We can just build off of those tax services. The second way we fund it is by kind of, as the affirmative advocacy says, uses the funding we use for welfare, but instead trade it off with funding at UBS. And I think a really important delineation to make in today's round isn't of how we fund a UBS or a UBI, but the comparison between the two. We should be comparing which is cheaper and how we fund one or the other. We argue that a UBS is significantly cheaper, has a significantly smaller strain on the government to fund such a project because a lot of the infrastructure necessary is already in place, which is why, again, our evidence from Canada found it's half the cost of a UBI.
Question, no, for the affirmative?
You're on to something in my mind when you talk about consumers having choice, right? You know, you're given this X amount of dollars, and you decide what's best for you, right? Maybe you want health care. Maybe you say, well, look, I want a better education. I might get a new job. And you know, the educated consumer is your best customer, that kind of thing. But what do we do with the impoverished people who don't often, not often, but do sometimes make bad choices, right? You give them this money, and they squander it. So they didn't get the health care, they didn't get the food, they used it on something, a luxury good, or you know, they have an addiction issue, they used it to feed their addiction, whatever it might be. How do you solve for the worst off with a program that doesn't actually guarantee that they're gonna spend the money you give them in the best way possible? Because usually poverty is a symptom of other issues, right? It's not just that you lack money, right? There's a reason why you lack money. If there's opportunity, right? So they're saying you get services. So you need healthcare, you just get healthcare. You're saying I give you $10,000, you could pick what you buy. But what if I needed healthcare and didn't buy it?
We actually do address this argument, and it's in our case. We talk about how when people are in impoverished situations, their mindset worsens, which means they have worse financial decision making. But critically, an empirical study found in Finland, for example, because they now had a financial safety net, they're able to make better decisions, and that resulted in lower levels of stress and depressive symptoms. A study also in Singapore, based on basic cash transfers to households, found that one of the reasons for this poor mindset is because they feel desperate. But with the financial safety net that everyone is getting this, there's no way that they can be left out like welfare programs do right now, then they're able to spend on better things that are for them.
I have a question for the negative.
Okay.
So UBI, there's a sense of equality. Everyone gets the same amount of money. UBS, on the other hand, what you're proposing, how does it accomplish fairness and equality? For example, some people don't need any of these services, and yet they're going to bear the burden through taxation, for example, of providing those services to other people. And some people may need more education, and some people may need very little education, or housing, or you know, the free bus ride, or whatever. How do you get a sense of fairness?
I think that the debate should come down to equity versus equality. For UBI, when you give, let's say everyone's a different height, when you give the rich people and the poor people the exact same amount of money, you're keeping the exact same gap between the two populations. It's just a different gap. What we are arguing for is that 76% of poor people's income is spent on basic necessities. Hence, UBS furthers equality because most of that money no longer needs to be spent on basic services, so you're specifically giving the poor people a very big financial leg up against the rich. The comparison shouldn't be between poor people and other poor people because everyone gets services, but rather the rich versus the poor.
So I think you're saying basically you want to benefit the poor people more than the non-poor people. Is that fair?
That's fair, and that's the framework that both teams agreed to. Whichever team best helps impoverished individuals should win the debate. So whichever social reform you think best lifts more people out of poverty more effectively, UBI, UBS, that's the team you'd vote for.
So, wait, what is the test here? Is it which plan benefits the most people or which plan benefits the most people in need?
Most people in need. Yeah, that's what
That's what
we're.
you say.
But could I?
It's our turn to ask questions. You're agreeing to this, that we really want to focus on the least well-off people. And you say, we're not going to do means testing. We're not going to do welfare programs. Why is that then, right? Why are you giving Bill Gates free education and all? If you're accepting the criteria of focusing on the least well-off members of society, why aren't you means testing the provision of services?
So the hard part of like applying like logical arguments to like what countries actually have is that if you look to means tested provisions in other countries like developing countries, as good as means tested could be, the data for means tested welfare programs or any means tested program is really, really hard to implement in third world countries where governments have no access to data. That's why both teams agree some universal approach is probably better because for third world countries, providing everyone either an access to a service or access to income is a lot easier than assuming that these governments can provide income or services to specific people. Our argument is like richer people like Bill Gates wouldn't need those things like education, but by providing that access to education, middle and low-income individuals have the choice. Do they want to spend more money on privatized healthcare? If so, that's their decision. But if you're swamped in medical debt and would rather rely on public healthcare, then that's also their choice, and they have the decision to do that as well.
And to kind of add on to that, we can both agree that means-tested programs have failed, and the reason it has is because of the political unpopularity. People of middle and higher class don't feel the incentive to fund a program that they know is just going to the poor. That's why they isolate that these have failed, for example, in America. We indicate, to kind of add on to what Anya said, that a UBS is the best solution to address those in poverty because our GO evidence indicates the people in the lowest bracket of income spend over 76% of their total income on these necessities. We can better that by implementing services that are accessible to everybody, but specifically are the most beneficial to the poor.
A question back to the affirmative, guys.
I have a question for the affirmative.
Thank you.
Let's talk a little bit about feasibility and how to fund this. And I understand in your speech you explained that you could generate 330 billion, I think is what you mentioned, from a taxation that only applies to 99.x% of the or that does not apply to 99.x% of the population. How much money are you actually going to give in this universal basic income program? And does the expenditure equal the revenues of your proposed plan?
So we can't give you an exact dollar amount because we're talking about governments in general. It differs for GDP and population of every country. But our argument is that it should be enough to raise people above the poverty threshold. And in terms of funding that, there's a lot of different ways we could do that. But one example is progressive taxation, and one example is that ultra-millionaire tax that you referenced. There's also a lot of different progressive taxation we can use, but we can also, our argument also relies on cutting some welfare programs that right now are faulty. For example, SNAP misses 40% of people. They can't get benefits. It's better to just put that to UBI where it's guaranteed.
So, yeah, so there's 330 million people in the United States, 330 billion being generated. You're only going to generate $1,000 per resident of the United States in your program. You say it's more. You're not really being very clear about where the rest of the money is going to come from. Progressive wealth tax potentially is what you're saying. It's a little bit difficult for us to assess, this plan or this proposal without a little bit more clarity in terms of the cost, especially to be able to weigh it to a UBS.
There's a lot of different examples. The ultra-millionaire tax is just one, but there's also progressive tax hikes to change the top income tax bracket from 39.6% to 37, and that would also give us $24 billion annually. There's a lot of different places. On top of that, another part of our argument is economic stimulation, because it'll come back in a positive feedback loop once the economy is stronger and stronger, once we already have that UBI in place.
That's the U.S. And then your opponents asked you a question. I don't know if I really heard an answer from you guys with regards to, well, in some countries, developing countries, there's not really those ultra-millionaires to be able to tax. And I'm not sure, I understood your answer, which was, oh, it'll come over time, right? The economies will grow. But I still got to get access any of the benefits of the UBI, I need to give them money faster than maybe it can work. I'm a little bit confused. How does that work?
So we would say that on top of economic benefits in developing countries, we're also increasing government's accountability, just because they know that they have to provide a universal basic income and they can't lie about their practices anymore, and this money has to get to people's hands. So we're saying, even if, whether it be developed or developing countries, there are methods for governments to be accountable, to have this spending, and to increase the economy in the process.
So we would address problems like corruption that right now are draining money in developing countries. But even so, we would argue that in the context of the round, it's a lot easier for developing countries to offer money and cash transfers than it is for them to implement infrastructure over decades.
They wouldn't just print money. Jenny, I don't know, I said earlier that inflation was important for me, but it seems like an easy way to give people money is just to go to the printing press and just give them money.
Well, it seems to me both sides are proposing expensive plans, right?
Very.
Right. The difference really comes down to, you're saying the government does the spending. It builds the hospitals, builds the roads. You take this kind of out of the private sector and it becomes the government's job. You're saying, well, let's just give the people cash and let them spend it the way they want, and that they're gonna spend it wisely, or you know. So yours is a sort of a paternalistic approach. Yours is a more market-based approach, right? Put money in people's hands, they'll spend it the best they can, and I don't know if either of these is gonna be cheap, right? So why should we let the consumer decide? Why should we rely on the government? Why is the government the best determinant of what people need as opposed to the people themselves?
That's a great question, We'll give you about a minute apiece
Yeah.
to answer that question. So let's go here first.
So-
And then okay.
Quick clarification. I think UBS is both, because the government provides those access to services, but it's also up to the consumer to decide if they want the service or not. But the funding question specifically, our argument would be that a UBS would be fundamentally cheaper than a UBI. We provided numerous examples. For example, a lot of the examples they provide about Finland, the UBI program in just one country with just a couple thousand individuals, it lost money. In Alaska, the reason why they're able to fund it is because they have access to natural resources and oil. Not every country has access to that. UBS would be, for example, the example in Canada would be half the cost of a UBI compared to a UBS, because one, unlike a UBI, which has never been implemented actually in a government, semblances of a UBS have already existed. You're not revamping or remaking the wheel, because public transportation, for example, already exists in these countries, but it's a question of, are there roads to access to rural areas? So the funding issue is a lot better on a comparative of UBS, and I'm sure Jean will better clarify that in the speech since we're on time limits.
We would argue that a UBS is more expensive than a UBI, and that's on many different factors. But for one, for example, if the government is funding it, that means that they have to go to printing more money versus just funding it to individuals who will make that money back. Our argument is also about the effectiveness of the gains as a positive feedback loop and regaining that money in the economy. It's a lot easier if people at the bottom have more purchasing power. We decrease economic inequality, have more supply and demand, which comes back to the economy in ways that you don't see in their world. We would also say for infrastructure that takes decades to build, it's a lot simpler and a lot easier, less expensive to just supply money to everyone versus having to wait for decades for those kind of benefits to materialize. In our world, we would already have seen those economic benefits that come back to help.
That's time. Thank you very much. It was a good exchange. We have the final two speeches in this debate. The negative rebuttal will be presented by Jean, and you have 5 minutes whenever you're ready.
the Foundation for European Studies was correct. The debate hinges on whether a UBI or expanded social policies should be prioritized, and we have clearly articulated why providing basic services to everybody should be prioritized over giving cash to everybody. First is the cost beneficial. As our Canada empiric proves, sufficient UBS can be achieved at nearly half the cost of a UBI. Intuitively, pooling resources always goes further than individually portioning dollars. This is especially true in the context of real access. Giving individuals monies to buy services and products that they don't have access to where they live is wasting resources that could have been pooled to build infrastructure to deliver these services more directly. Second is it's more feasible. A UBS is not perfect, but compared to a UBI, it is definitely more practical, as proven by real-world examples. No country has ever provided every single resident unconditionally cash payments sufficient to cover basic needs. Nearly every single example cited by the affirmative is targeted, not universal. The closest example is Alaska, with a population of barely 700,000, and that annual payment was less than $3,300, nowhere near basic income levels. In contrast, multiple countries have already provided universal basic services in the forms of public schools and government-delivered healthcare. If a UBI is so efficient and so easy to implement, why has it never been attempted? Specifically, on the funding aspect, significantly more expensive as a UBI is especially unclear. Like, will they print money? Will they tax millionaires? Or what about countries that don't have these millionaires, etc.? Comparatively, funding a UBS is super simple. We want to use already existing tax brackets and infrastructure systems to create better access. The third benefit of a universal basic services is that it's less inflationary. The logic of our Winningham evidence is irrefutable. UBI is massive, but only one-sided government intervention into the marketplace, giving consumers money to spend while doing nothing to constrain the power of sellers to raise prices. The inevitable result is runaway inflation as businesses exploit opportunities to raise prices, triggering necessary increases in UBI, which restarts the cycle. UBS avoids this mistake by intervening on the supply side, providing basic services. The fourth and final benefit of a UBS is that it's socially responsible and environmentally sustainable. There's not a single response that the affirmative gives to this argument in their previous speeches. They highlight that a UBI is more beneficial for individuals to choose what they want to spend it on, but they have missed the fact that our constructive evidence from Thompson indicates that while a UBI atomizes, a UBI strengthens ties to reciprocity and solidarity. This is special because it improves the amount of environmental collectivism we can have as a country together to decrease total climate change. The fifth and final benefit is personal choice. We agree that people need different things. The critical distinction is that whereas a UBI lets people spend their money on anything, resulting in a lot of that money being squandered, a UBS restricts the choice to basic necessities, which stops money from being used on various unnecessary things, and hence ensures the poor are the ones who receive it most. Even if they win their argument on the economic benefits of a UBI, in the long term, a UBS is still significantly better in solving for the economy. This is a place you're voting negative. They argue that the poorest have more spending power. However, this argument is logically unsound. Every single person in society is provided $1,000, not just the poor, even the Bill Gates of our society. We argue a UBS is the best solution to solve the disparity of poverty because, as our Go evidence from case indicates, the poorest of the poor spend over 76% of their income on necessities. By freeing up that spending space, we have a universal approach with benefits of helping those in need. Here's why a UBS is significantly more feasible and sufficient than a UBI. Firstly, the foundations of a UBS already exist. People already have access to public transportation, public healthcare, etc., which is why in Canada, the cost of a UBI is approximately double that of a UBS. Secondly, every single empiric they cite as to how UBS has worked in the past is flawed. For example, Alaska had natural resources that other countries don't, especially developing ones. Secondly, the example of Finland failed because they funded their program because they couldn't afford it, and they only provided 2,000 people who were unemployed the benefits. That's not universal, that's not unconditional, that's not a UBI. Reject the other examples as evidence of UBI failing. UBS already has a foundation, whereas UBI has never happened in any country globally and has never been invested in, while UBS has examples of it being successful in the past. There's no reason to worry about the funding issues of a UBS. You are not remaking the wheel. There's already semblances of transportation, healthcare, etc. It is not an entirely newly funded initiative like a UBI is. And secondly, it's a comparative debate. Our evidence indicates that a UBS in Canada will be half the cost. That's because, look, every single individual in this room gets $1,000 for a month versus providing services of access that is financially more efficient than a UBI if you do a comparison. As they tell you in their second speech, needs differ from person to person, with global poverty declining from 36 to 9%,
Throwing money doesn't solve the problem. Curate the actual solutions and the gates.
Time. Affirmative. Final rebuttal for a period not to exceed 5 minutes. You can begin.
Let's clean up this debate, but let's start in chronological order and start with the idea of the status quo. If we're talking about the idea of whose studies and precedence is better, we would argue it's our side for a few reasons. First, our example of Alaska was government funded by the state. It's been going on for 42 years without interruptions, and evidence finds that 64% of Alaskans would prefer to just increase the income tax to continue spending on the UBI rather than stop the UBI entirely. Additionally, we have other examples such as Finland. They say that Finland was discontinued after 2 years, but it was only planned to exist for 2 years. It still shows the benefits of the UBI on populations. Additionally, if we are talking about which side has better precedents, and they lambast our evidence about Alaska, Finland, California, and Namibia, but their only evidence is about what would happen in Canada, a simulation, and not the actual experiment that took place, we would argue that if you're looking at the real-world impacts, our side is better. Then, let's go on to this idea of the COVID-19 crisis, which is another part that goes unaddressed because they are arguing for the status quo, but they tried to use the excuse that COVID-19 was an outlier. That just shows the inability of welfare programs to respond to crises. Second, let's talk about what happens after you affirm with the idea of funding, because there's a few ways that we can fund a universal basic income, and they're all more feasible than what would be with universal basic services. For example, progressive taxation means that the people with the highest incomes are the people who are taxed versus the lowest incomes, and we're proportionately helping them based on how much income they have. And that means, for example, in the US, we could get $300 billion from the ultra-millionaire tax. But even so, in developing countries where there aren't people to tax with higher incomes, we would argue that you can actually take from existing welfare programs. That's because right now they are missing hundreds of millions of people who don't qualify for the program but are still impoverished. But with universal basic income, we take that funding from faulty programs and increase accountability because people will understand if they've been cheated out of the system because they won't get the payment that they deserve. That means it's a win-win for the universal basic income. We would also argue a better way to fund the universal basic income is that the benefits come back in a positive feedback loop because you are benefiting the economy through a few ways. First is increasing consumer confidence because increased consumer spending through specifically giving money cash versus increasing spending is a lot faster than like having these services. And second is supply and demand. And we would actually argue that by increasing workforce productivity, giving financial safety nets, we're increasing the amount of economic stimulus that comes back to us. Then we would also argue that if we're talking about the idea of funding a UBS, there is much more infrastructure that has to be built, which is a lot less effective for the government and a lot less surefire that they're going to be able to do it in an accountable way versus what we have with a universal basic income. Then, next, let's go on to the idea of inflation, because it's pretty important. We would actually argue that because our side uniquely is the one that increases productivity and meets that supply and demand. They tell you that they're meeting increases of demand by increasing services, but that doesn't matter if the workforce productivity is lowered. But our side specifically finds that when you increase methods of, for example, financial security and more employment because they can take chances, that is much more immediate than anything you see on their side. We are solving back for the costs of funding this program a lot faster than they can. And an UBS would still increase inflation, but on an even greater scale because it's a bigger actor. The government is spending billions of dollars into these services, whereas in our case, only the people at the bottom with the least purchasing power are increasing their money. It doesn't matter if we give Bill Gates versus someone in poverty $1,000, it's much less different for them. And we would say that the people in the lowest are able to spend a lot more. That means that we solve back for any problems coming from inflation. But then lastly, let's go on to this central idea of a universal basic services, because the greatest mistake that the negative makes in this round is hinging their advocacy on this idea. There are 5 problems. First, there is not an effective time frame that they can give you, nor any precedents. We have no idea when this will materialize, so we can see those benefits that will counteract the cost. But the second reason is because needs differ among everyone, which means they cannot be flexible with the services they're given. Not everyone needs, for example, the healthcare benefits they're talking about. But if you give people flexible money, you stop perpetuating a world order where the wealthy are dictating what the lower income class can deserve. And then third, another reason is because we would argue there are still bureaucratic holes with universal basic services. For example, if right now the government can't figure out how to use welfare programs, there is zero guarantee that they can figure out how to effectively implement services that affect everyone in need. Universal basic incomes are exactly that, and you know everyone is getting what they need to help. And then the last problem is specifically with the developing world. They give you no clear examples of developing world infrastructure, only referencing the US and other countries such as Canada. It's high time for a UBI. Please affirm.
Congratulations to Hamilton and Ivy Bridge Academy. A big thank you to our judges. The judges will now have a few minutes to complete their ballots, and then we will announce which team will be moving on to the final debate this afternoon.